I am professor and chairman of the Department of Ophthalmology and Visual Sciences at the University of Maryland School of Medicine here in Baltimore. I am a cornea specialist by training. I did my residency at the Cleveland Clinic. I graduated in 2002. 2 years ago, I was recruited here to be chairman of this department. I was interested in a program that would keep all the doors open for me. And so I always knew I wanted to be in academics, but I wanted to be able to see everything. So the Cleveland Clinic offered the opportunity for exceptional clinical training, but still had a heavy slant towards creating academicians. So I felt that that would be the best place for me to train. The biggest challenge of anyone going into ophthalmology is the fact that we don't get a lot of it in medical school. And so it's not like learning medicine where we have a basis of general medicine coming out of medical school. This is something completely different. So we're basically starting from square one and learning a field, a complete field in 3 years. The strengths of the program at the Cleveland Clinic are a little bit different than what a lot of people applying may normally think about. As residents at the time, everybody was concerned about having autonomy. In truth, having autonomy when you don't know what you're doing is actually not that great of an idea. And so one of the biggest strengths of the Cleveland Clinic is the amount of time that we spend one-on-one with world-renowned faculty to teach us how to take care of patients and about disease processes that are very complex. And if we are on our own, I think that we wouldn't be providing the best of patient care. In addition, as a world referral center, essentially, our experiences there were enormous. We were able to see the gamut of disease processes in the eye. So residency is, in many ways, still like an apprenticeship. And so even though most residencies have didactic curricula set up where there are lectures and journal clubs, which are expected, I think the thing that sets programs apart is the opportunity to have one-on-one informal teaching regarding patients that are seen in a practice. So I had that at the Cleveland Clinic. After every long day of seeing patients, we had the opportunity to talk informally about patients. And I think that was a wonderful opportunity. No matter what field you go into, you're just kind of setting out on your own after medical school and you're being called doctor, and you don't always think you know what you're doing. And so times can be stressful. There's a lot to learn in ophthalmology. Fortunately for me, my wife was also in medicine. We were both residents at the same time, and so sharing experiences when we got to see each other was soothing, if you will. And I actually had my first child during residency, and so took a lot of stress off my mind being with family. So the Resident and Alumni Research Day was one of the highlights of our residency. Every year in June, right before graduation, all the residents and faculty members presented at this day. It was more than just Resident Day, it was Resident and Alumni Day. The fact that faculty presented alongside of us really showed us how collegial the department was and how much we were colleagues. Different departments do it differently. Some departments only have residents present. Because of my experience at the Cleveland Clinic, that is how I changed our Residence Day here in Maryland, to have both the faculty as well as the residents presenting. It serves as a role model for the faculty to be presenting to show the residents how to do it. But it's also for the residents a culmination of a year's worth of research, a year or more worth of research, and showcasing what they've done. When I was a resident, there were many faculty members that were extremely dedicated to education and went above and beyond what I would think is normal. One person in particular truly went above and beyond to help me get into the fellowship that was the very best in the country, and then was instrumental in bringing me back to be on faculty at the Cleveland Clinic. My residency at the Cleveland Clinic is the reason that I'm here today. I think that the mentorship and the training that I received was top-notch. And ophthalmology is a small field, and so mentoring and getting to know people who are experts in their field is important, both from a clinical and an academic standpoint. My mentors gave me so much opportunity to better myself clinically, as well as achieve recognition on a national level for what I do.